Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. Gary Alder of Global Facial Aesthetics in Chicago. For more than 30 years, Dr. Alder has been dedicated to providing quality dental care to those searching for general, family, implant, and cosmetic procedures. Welcome, Dr. Alder.
Thanks, Mike. It's good to see you again.
Why, thank you very much, sir. Dr. Alder, today we're going to be talking about dental implants. So could you tell us, just kind of give us a general overview right now about dental implants?
Well, dental implants have come on strong the last 30 or so years. In modern dentistry, we can now deliver treatment like dental implants that dentists have been dreaming about since the age of the pharaohs. It's a routine procedure nowadays, and it's benefited many people, hundreds and thousands of people.
Well, can you tell our viewers what's been your experience with dental implants?
Well, I was fortunate enough to become a dentist about the time dental implants were becoming popular and been able to see the evolution of implants. Probably the biggest jump in the success rate of dental implants has been the discovery of titanium. It was accidentally found that titanium bonds to bone very well, which we call integration, and becomes part of the body.
Well, can you kind of describe for our viewers what's been the evolution of dental implants since the beginning till now?
Well, in the beginning, very beginning, we didn't have titanium. That's probably the biggest change. But the most popular implant nowadays is a cylinder implant. There are some variations of that, and it's been the best success that we've had. There's many companies on the market nowadays, and all of them work pretty well, but you want to make sure that you deal with one that's been around for a long time.
I see. Now, I understand that there are many different variations of cylinder implants. Can you talk to us a little bit about that?
Well, most of the cylinder implants have different types of grooves, threads on them, and so forth. Some of the newer ones are trying out what they call a fiber metal type of structure, and it's yet to be seen whether that's going to be good. Other implants that I use, we call them mini implants. They're like 1.5 millimeters, 2 millimeters in diameter, rather than several millimeters in diameter. But implants generally are ranging from the 2 millimeter size in diameter up to I started recently using a 7 millimeter diameter, which works very well in the posterior teeth in the molar region. Another implant I've used for several years is an expandable implant. It has special uses. I like to use it in the anterior when a tooth needs to come out, and nobody wants to run around without their front tooth, so we can put this implant in, expand it, and put a temporary crown on it the same day with a high degree of probability that this is going to work well. We can continue to expand it as it integrates as well, so it's not a one shot and hope and pray that it works. We can actually work with it later on, make sure that it does work.
Well, let me ask you, of all the different variations, which one's your favorite?
Well, they all have different uses. It kind of depends on the location that you're using it for. There's special situations. The skinny implants, they're very good at replacing lower anterior teeth, for example, whereas a thick implant, wide diameter implant, wouldn't work at all. And it also, the skinny implants are nice for people who have dentures. We can place a few skinny implants and place the denture, sometimes even retrofit the denture to the thin implant and secure the denture that way. It's relatively a lot less expensive than some of the other modalities that were proposed.
So the skinny implant, that's your favorite?
I wouldn't say that's my favorite. I don't really have a favorite so much as depending on the circumstance. I have a favorite one that I like to use for that circumstance. The skinny ones, they have a place, but they're not going to be as strong enough to hold in a molar position, for example. So you have to use the right instrument, right tool, the right club to. If you're golfing, you have to use the right club to hit the ball the right place. So in dental implants, you want to use the right implant in the right situation.
Well, speaking of the right implant and the right uh,
Right situation.
right situation, yeah. I'm just trying to think. Maybe you could talk a little bit about who would be the ideal patient for each one of those.
Well, it depends a lot on what the patient's bone structure is like. Although nowadays we can enhance the bone structure by bone grafting and so forth, but it mainly depends. My selection of the implant mainly depends on the structure of the bone and what kind of prosthesis we're going to use over the bone, over the implant, excuse me, to restore patient to natural occlusion and aesthetics.
Well, maybe you can describe for our viewers what are some of the advantages and some of the disadvantages for getting a dental implant.
Well, dental implants are highly advantaged because compared to, say, doing nothing or a fixed bridge. We know that dental implants outlast fixed bridges, so they're becoming more and more passé. Dental implants are better than removable bridges, partial dentures and so forth, because they can stay in, you can chew better, function better, more cosmetic. Some of the disadvantages in implants are still slightly more expensive than some of the other modalities, especially more expensive than doing nothing, but doing nothing has some disadvantages too. One of the big advantages of dental implants is it helps preserve the bone. If we do nothing, the bone tends to melt away over the years, and then it decreases our ability to place an implant or place an implant the way we would have liked to several years ago. But still, we can enhance that bone.
Let me ask you, if someone was looking or considering getting a dental implant, what should they be doing?
Well, they should look around. They should look in their neighborhood, talk to their dentist, see somebody who's the dentist is familiar with. Placing the dental implant is actually the more simple part of the dental implant process. It's very important that the dentist work with someone who's experienced in placing the implants, and that the person restoring the implants is experienced as well. You know, a good implant can be ruined by a bad restoration and vice versa. So it's a team approach oftentimes. I myself both place and restore the implants. But you need to look for someone who is comfortable doing that, has some background in it. Although many people do. At this point in time, it's become a relatively routine procedure throughout the Americas for sure.
Dr. Alder, you've given our viewers a lot of great information about dental implants. Do you have any other thing you'd like to add?
Well, I would encourage people to consider implants over, say, a fixed bridge, which is the traditional way of replacing a single tooth, especially, or 2 or 3 teeth. And mainly because we don't have to drill down a perfectly good tooth to make a bridge. With the implants, they're standalone. They look, feel, and function very much like the original tooth that was there, sometimes better. And we know now that dental implants are actually outlasting 3-tooth bridges, 4-tooth bridges, and they're outlasting teeth that have compromised in other ways, such as extensive root canal treatment or extensive restorations or extensive bone loss. So at this point in time, a good implant is better than a not-so-good tooth, but never is a good tooth should be sacrificed for an implant. It's always wise to keep your own teeth.
I think that's great advice, and I'd like to thank you for being on this interview. You've given our viewers a lot of great information about dental implants.
Thanks, Mike. It's always great to talk about. It's a great topic. It's something that's really made dentistry come forward. The science behind it and the improvements we've made over especially the last 30 years are quite remarkable. And now we know that it's a very successful, long-term, long-lasting, virtually painless procedure. Post-operative recovery is minimal. Patients have minimal pain, generally speaking. So it's something to be embraced. And if we live long enough, probably you're going to have the opportunity to have a dental implant or some other type of titanium implant of your hips or joints and that sort of thing.
Again, thank you so much for the information. I'm sure that all of our viewers are going to find this video very informative.
It's always a pleasure to talk to you, Mike. Have a great day.
Thank you, sir. Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. Gary Alder of Global Facial Aesthetics in Chicago, Illinois. If any of our viewers would like to get more information from Dr. Alder, please refer to the phone number at the end of this video. Again, Dr. Alder, thank you again.
All right. Thank you, Mike.
Take care.